And now to some updates on the latest regarding COVID-19 in the country. Now, as we rush to achieve the target of 5.8 million people vaccinated by the 20th of October, transporting the vaccines from regional depots to areas in need remains the biggest challenge. The Senate Health Committee says it is a responsibility that rests solely with the Ministry of Health and county governments, given the budget allocations that have been made. And as Raquel Magai reports, some counties like Mombasa are yet to receive their share of the Pfizer vaccines owing to logistical issues.
The last 1 week between 25th September and 30th September has seen the country issue an average of between 13,170 doses to 49,846 doses a day. That being quite low from the target of 100,000 set by the Ministry of Health if they are to achieve the goal of having 5.8 million people vaccinated by Mashujadi. During a visit to the National Vaccine Depot in Kitengela by the Ministry of Health and the Senate Health Committee, it was clear that there was another challenge, aside from the one that involved asking Kenyans to come out and get the job.
We want the ministry to be able to realign their existing resources during this time of this pandemic and assist county governments to be able to transport these vaccines all the way to the county governments. There's no reason as to why the county government should come into this vaccination center and collect the vaccines from here, yet we know the situation on the ground.
According to the committee, over 100 billion shillings was allocated to the Ministry of Health under the Division of Revenue Bill, funds that should be used to sort out COVID-19 related challenges such as this.
And we'll also share with the counties. If it is the money that is the problem, we'll need to sit down with the governors and to really tell them that how come some counties are at 40% vaccination and some are at 1% only. So that is something that as a committee we have to look into.
The Ministry of Health is finalizing its plans to begin vaccination using the Pfizer vaccine from next week, following the arrival of special syringes required for dispensing of the job, termed as being delicate.
And that's why we want pre-registration. We want to know how many people will be there, and we take that Pfizer there. That is very important to know that the shelf life of Pfizer is dynamic. It depends on when you start using it.
The ministry making assurances of provision of vaccines and ensuring that they do not expire.
The more we get vaccinated, we reach a certain level of vaccination, we will have comfort to be able to reopen and come back slowly, perhaps, to the norm that we are used to.
In the last 24 hours, 260 new infections have been recorded from a sample size of 6,226. The positivity rate stands at 4.2%. 4 deaths have also been recorded, all being late death reports, raising the number of cumulative fatalities to 5,123. Raquel Muigai, Citizen TV.